For individuals with kidney disease, dietary choices can significantly impact their health and the progression of their condition. Protein intake, especially from sources like chicken, is a key consideration in managing kidney disease. Here's a comprehensive overview based on research and guidelines from health authorities. For kidney patients, managing protein intake is crucial because the kidneys are responsible for filtering waste products from protein metabolism. When the kidneys are not functioning properly, high levels of protein can cause an accumulation of waste products in the blood, leading to further kidney damage. Chicken is considered a high-quality protein because it contains all of the essential amino acids required by the body. For individuals with kidney disease, especially those in the earlier stages, a moderate amount of high-quality protein can help maintain body functions while reducing the workload on the kidneys. Chicken is lower in phosphorus and potassium compared to red meats, making it a better choice for individuals with kidney disease. High levels of phosphorus and potassium can be harmful to those with compromised kidney function. How chicken is prepared can also impact its suitability for a kidney-friendly diet. Baking, grilling, or boiling chicken without adding salt or high-sodium sauces is recommended to keep sodium intake low. Excessive sodium can increase blood pressure and worsen kidney health. Now let's see what the research and guidelines have to say about this. National Kidney Foundation suggests that patients with chronic kidney disease should consume low to moderate amounts of high-quality protein like chicken. They emphasize the importance of working with a healthcare provider or dietitian to create an individualized eating plan that considers the stage of kidney disease, laboratory results, and nutritional needs. Research suggests that dietary approaches focusing on the quality of protein, along with the overall pattern of nutrient intake, can play a significant role in managing CKD. Diets such as the DASH diet, which is rich in fruits, vegetables, whole grains, and lean proteins like chicken, have been shown to support kidney health. So, chicken can be a suitable protein choice for kidney patients when consumed in appropriate amounts and prepared in a kidney-friendly manner. Remember, this overview is based on general guidelines and research. It's always important to consult with healthcare providers or a renal dietitian for advice tailored to individual health conditions and dietary needs. If you like this video, please like and subscribe my YouTube channel. Thanks for watching.